Quality alert is really taking a toll on people living all across the region.
A growing number are complaining of headaches, sore throats, other issues related to this toxic smoke. And health reporter Stephanie Stahl joining us with more on how hospitals are coping with all this.
More are getting busy. The Philadelphia Health Commissioner says there has not been a significant increase in emergency visits, but many hospitals and urgent care centers outside the city are seeing more people with issues related to this smoke.
The smoke is definitely impacting my lungs. It's hard to breathe.
Kelly Stretton, an emergency nurse at Virtual Marlton, is not only taking care of people having symptoms related to the smoke, she has her own issues related to 2 bouts with COVID.
It's kind of scary with the COVID and having some lung issues and some scarring from that. Having a bilateral pneumonia just triggers some what I would call asthma-like features.
Here's the first line of treatment in the emergency department with people with breathing difficulties, a nebulizer that delivers a fine mist.
The patients would just inhale this.
Dr. Craig Turner says breathing the medicated mist helps open airways that get irritated and constricted by breathing pollution from the wildfire smoke.
The biggest concern really is patients with lower airway symptomatology. Patients who have asthma, emphysema may have some increased respiratory difficulties.
He says difficulty breathing can cause oxygen levels to drop, which can also trigger a variety of heart complications.
Elderly patients, with cardiovascular disease are at increased risk. If there's significant inhalation injury and oxygen levels drop, they could be at increased risk of some cardiovascular symptoms.
In addition to oxygen and steroids, Dr. Turner says patients may need additional interventions.
Just by looking outside and seeing that haze and smelling that smoke, we know that this could be problematic for some of our respiratory patients.
He says most cases can be easily managed. For Kelly, the smoke brings a new complication in being on the front lines of medicine.
It's very concerning. You don't want to be sick. I'm young. I don't have time to be sick.
Now, in addition to respiratory problems, doctors say the smoke is also causing eye irritation. And the longer the air quality alert continues, doctors expect to see a growing number of patients with symptoms from this pollution. Best advice, as we've been saying all along, stay inside as much as you can.
Yeah. Absolutely. Thank you.